Folks, thanks for joining us today. My name's John Dubas with Premier Marketing, and we'll be taking the next hour or so discussing an in-depth look into marketing dual special needs programs, a Medicare Advantage special needs plan that's designated for the dual beneficiary. The presentation today is being recorded, and it, along with much of the material that we'll reference throughout the course of the presentation, will be sent to everyone by email that has registered for today's webinar. Keep in mind as well that sometimes links or attachments on an email will put that message into a spam filter. So if you don't receive a copy of this in the next day or so, make certain that you check your spam filter. And of course, let me know and we'll get another section sent out to you as well. A bit of housekeeping, you'll note in the software that there's a question section. Please put your questions in there. We find we answer most of them through the course of the presentation, but we'll check to make certain that we address your concerns or your questions as well before we disconnect. And if I don't have the answer, we'll research it and get it for you. First, we'll start out with a level set about who Premier Marketing is. Some of you are very familiar with us, some not so much. We're a national marketing organization founded in 1968. We're part of the Integrity Marketing Platform with offices across the country. We act as an insurance wholesaler for the public through independent agents such as yourself, and we do so through a contracting arrangement at the highest possible commission level, and recruiting contracts are available to those who qualify. When we look at the portfolio of products that we offer, this is how we extend ourselves beyond just the Medicare programs of Medicare Advantage, Medicare Supplement, and standalone Part B drug programs, because we also offer a full portfolio of life insurance and annuity products, final expense life insurance and pre-need plans, long and short-term care insurance programs, disability income plans, and the ancillary benefits. This includes the dental, vision, hearing programs, critical illness cancer plans, hospital indemnity, accident programs, and we're even rolling out a telehealth program this next month. When you look at the Medicare Advantage carriers, it has the national leaders as part of that portfolio available to you through our organization. It also includes many of the strong regionals that make a difference for you in your market, and we carry that same philosophy over into the prescription drug plans, where those national carriers are there for your use through our organization. When we look at Medicare Supplements, we have a very robust portfolio and tools that are designated to help this section of the Medicare world be marketed we have a lot of marketing support, I'm going to put it that way, for the Medicare Supplement programs that are part of our portfolio. Same philosophy, once again, in ancillary products. For in each of the categories, the national leaders are there for you through our organization, and it really does make a difference in covering the needs for your prospects and clients, gives you an additional revenue stream, and helps drive up your persistency, your retention, in addition to having another way to market. When we look at the Medicare market overall, and we look at the aging of the baby boomers, the silver tsunami, one every 10 seconds, 10,000 plus a day, we're looking at a number that makes up the folks that are over the age of 65. But if you consider that just the Medicare market, you're being skewed just a little bit, where there are an increasing number of people that aren't accessing full Medicare benefits when they turn 65. They'll come into the program later for one reason or another. But we also have a sizable portion that's under the age of 65 accessing Medicare benefits because of disability. And when you look at about, 1/6 to 1/7 of the market being under 65, that's something that we really need to address. And many times this is a population that is also particularly affected by economic circumstances and are, in many cases, a perfect prospect for a dual special needs program as well. That's because the income and assets are limited, so they qualify for different assistance programs, be they over the age of 65 or under the age of 65. There's a little different breakup between the numbers of people in different categories, but it is a population that really needs our help because they have a number of health circumstances on average. 2/3 of the population actually has 3+ chronic conditions. And when you look at the dual population, they are really affected in this area as well. They make up a much smaller percentage of the Medicare population in proportion to what is being spent through the different programs for health circumstances, be they physical or mental. That challenge with the income and assets then really behooves us to know the different assistance programs that are available and the different means that we can do to enlarge our prospect pool just by being aware of what a qualifying individual needs to do to get the extra help for us to help him with the DSNP program. Just keep in mind, they got a ton of different choices. When you come on Medicare, you don't even have to take the Part B. You can decline that. Most don't. Some folks will just keep original Medicare and add a program to help them with the cost of their medications in the Plan D programs. You have a bit of an other end of the spectrum for some of the folks from the DSNP population that are selecting Medicare Supplements. It tends to be a little more of an affluent group. And you have a number of people that are accessing the Medicare Advantage programs, which includes a subset of plans we refer to as special needs programs. We'll discuss that in greater detail in just a moment. The folks that are coming on Medicare are taking a pragmatic look at their health care and are doing it where it's almost an even split between the two major options for Medicare medical assistance, a supplemental program of sorts, even though Medicare Advantage is not a true supplemental program. Pretty even split, but you got that percentage of the Medicare population that appear to be doing nothing. Not quite true. This is where some of our dual beneficiaries will be found. This is also where some folks that are accessing VA or retirement benefits are in there. And then there's of course, the population that hasn't taken anything else out besides original Medicare. Varied population, having a pragmatic outlook, a way of looking at the plans that are available for that suitable population really has us working on different programs like today's topic with the dual special needs plans. There's an increasing number of companies out there that are offering these programs, and you are seeing many of the carriers that do have a marketing budget and also feet on the street that help you market these plans as well. One of the things we will include as part of the follow-up to today's presentation as well is a link to this acronym guide from Medicare itself, the Medicare Learning Network. It helps with all of the different initials that go floating out there that we sometimes don't know what they mean. I actually got stumped on an acronym on yesterday's webinar. So it's a great guide to have and a way for you to translate some of the correspondence your prospects and clients may be receiving. Medicare Advantage programs obviously have different times in which an individual can enroll, disenroll, or change programs. These are the standard election periods that most are very aware of. But the first 3 months of the year with the open enrollment period is kind of an interesting one because it's an opportunity for someone on an MA plan to change to a different type of MA coverage, basically. But we are regulated as to how we can market the awareness of that program. And as I mentioned, since this is basically set up for someone who's gotten on a Medicare Advantage program and switched between different types, those folks that are looking to change programs for whatever other reason can look at special election periods throughout the year as well. But it is an opportunity for those that are affected or enrolled in these programs to make those switches. You'll note the only way in this program that someone can add prescription drug coverage if they don't qualify for a different SEP or other circumstance is the only program that will add the prescription drugs is from an MA only to an MAPD program. So it's an interesting thing to look at. It's not a continuation of AEP. There are, as I mentioned, certain things that we cannot do. We're not to target the population specifically that has unsolicited materials referencing this, even though we're seeing it on different ads, on social media, that sort of thing, even referenced occasionally on television on one of the lovely ads that go there. Just because someone else is breaking the rules, though, doesn't mean we need to. And it is important to note, too, that there are the standard things that we can do and do well, as many of you do, is the fact that you can set up the regular meetings for other reasons and follow through should OEP be an effective choice for these people to use as a switch. But you got a ton of other steps. There are 20 standard ones that are available in our world on today's topic. There's a few of them, obviously, that are being affected by money, income, and assets. And so that gives us an idea as to what we can use to help people change their coverages. There's even different weather special election periods that are ongoing. One that was announced day before yesterday for the state of Texas to deal with our lovely reaction to the weather storm that we had all week last week. For folks that are looking for an SEP for COVID, in the Medicare world, that's expired. In the under 65 world, due to an executive order by President Biden, a 3-month period started February 15th and will continue for 3 months, but that's not Medicare. One of the reasons we go through this with such great intensity here is because the majority of people that are on Medicare don't check their plans on an annual basis. 57% of the Medicare beneficiaries do not review or compare their coverage options annually per Kaiser Family Foundation. So that is because of a number of different reasons. Some of them are particularly within the roundhouse of today's prospect base, where a larger share of these beneficiaries are older, they have lower income, lower education, and they have some challenges with their health. So they don't necessarily look to change coverage every year for one reason or another. They don't examine it. So it's kind of an ostrich approach where that's got to be the best thing for me, even though a third of them would have some challenges understanding the Medicare program in its whole. And that misunderstanding is actually higher in some of the groups that are more frequently affected by DSNP programs. So you got a whole number of gambit of things that you deal with the population that's directly affected by the dual special needs program. And it's also a population that is heavily in this category where the resources that are put out there by the government aren't accessed as well. So we need to make certain that they understand what their benefits are. The government sends out either a hard copy of the Medicare and U-Book or an electronic version to everybody that's on Medicare in October. And there is that app now that we can download, and it's the What Covered app, so we can have good, hard answers to hard questions as they come up, and it gives you more of an immediate response. Really does enhance your professionalism and, of course, your access to resources. Everything we talk about is based on a reality world or a virtual world. In these circumstances, the Dual Special Needs Program is targeted at a population that doesn't necessarily have as much access to different tools electronically, but in many circumstances, they have family that can assist them, and there is still a strong percentage of these folks that we can reach virtually, looking to make certain that they have all the coverages they need. You'll see through the course of the presentation, hopefully, different types of access to this population and how they are being affected, particularly by the current pandemic. Once again, as we start to speak with folks that are on Medicare, regardless of their type of eligibility or what programs they may be able to access, a great source for that is our little Bible from the government, in a manner of speaking, with the Medicare and U-Book that goes through and covers all sorts of topics that are part of the Medicare plans. And in general, Medicare Advantage programs, these Part C programs or MA plans, are an alternative to original Medicare on how an individual accesses the program. They're not giving up their Medicare. If they did, they wouldn't qualify for an MA program, but they are assigning it to a private organization to provide the benefits and access all the different types of programs that are available under traditional Medicare programs. So it goes beyond doctors and hospitals. It goes into anybody who's billing for services that are covered by Medicare. Durable medical equipment companies, home health care companies are the things that we see most frequently. Most of the programs that are available in the Medicare Advantage space are a program with an integrated drug benefit, and if a plan is designated as a special needs program, well, you can't get a special needs plan without medication coverage. It's integrated into the system. It's one of the requirements for a MA plan to be designated or act as a special needs program. You'll see in this category as well, when we look at special needs plans, this is where many of the social determinant of health benefits come into play. So those extra benefits, in many circumstances within the last couple of years, have gone well beyond just medical benefits. They have all sorts of additional assistance that are available through these programs. It's like the Joe Namath commercial on TV. Sorry to bring up a sore spot, but these are things that are standardly available in the type of the program that is being discussed. It's not necessarily in every program and in every service area. A lot of talk, however, on transportation and on telehealth within these programs. The most accessed program and some of the extras does fall into the round of your mouth with the dental programs. Enrollment overall in the Medicare Advantage plans is just blowing up. It's exponential growth. So we don't see a lot of really changes in that because of any political situation or who sits in the Oval Office. This last year, coming into 2021, we saw a proliferation of the number of plans that are out there as well. And you see the usual suspects offering the greatest number of programs across the country as well. When you speak of not just what plans that are available, but who's already in Medicare Advantage plans, this gives you an idea of the market and some of the market leaders. Once again, as they say in Casablanca, the usual suspects, strong leader listed here as well. When we talk about special needs programs, particularly, we're seeing a good pattern of growth as well. The numbers, obviously, as a subset of the overall Medicare Advantage plans, are large, but you'll see that of the three types that we'll briefly define in just a moment, the vast majority of people that are in a special needs program are dual eligibles. A lot of this is dictated, of course, because the folks that are more economically challenged have a greater impetus, obviously, to get some help with the cost of different programs that or services that are being provided to them. And so the programs that might help pay for that are of great interest to those individuals. And many times it's the extras that make a difference for them. You'll have different carriers out there that will help you with the discussion, that will help you and your clients and prospects understand what is a dual special needs program. This is a 3.5-minute video provided to us by United Healthcare. They also have one that's specifically designated to talk about their dual special needs programs, but so do a number of other carriers. And that's why we have within the agent portal on our website where you can access those 2021 benefits with the different plans in detail and help make certain that you have the information you need to properly discuss the opportunities that folks have. Because keep in mind that electronic savvy is growing. We can do a lot of things telephonically or remotely with this population, as certainly if we have planned for that circumstance. And there are times, too, where you may not have a one-call close, and doing some of the follow-ups in a virtual type of circumstance can really help you with time management, be more efficient, and still stay compliant. So some different things to consider when addressing this population. We can use the government detail much as where the population doesn't have, more than half of it don't, we have access to that program. We can help them set up their accounts, be an advocate, and use it as a third-party verifier, basically, of some of what we do. But when we specifically speak to SNPs, these are a subset, a certain type of Medicare Advantage plan that was created clear back in 2003 by the Medicare Modernization Act, and has been validated by different pieces of legislation thereafter. These are programs, excuse me, my sinuses today, that are focused on certain vulnerable groups of Medicare beneficiaries, and so the plans are designed to help address the special needs of these folks that are eligible for it. Normally, they'll fall into different categories, and the plans will then make certain that the way the benefits are set up help address that particular circumstance. There are three types of special needs programs. There's the chronic special needs programs that have different programs that are available based on Medicare eligibility and certain health conditions. There's the institutional SNP. I have that line through because in many instances, this is a program designated for people in certain living circumstances, but are normally offered through a captive sales force, not available through the broker channel in most cases. There are certain markets where there are exceptions. And then, of course, there's today's topic, which is the dual special needs plan, which is designated specifically as a program of interest for those on Medicare and Medicaid. For someone to be able to enroll into a dual SNP, they have to have some of the different things that we have discussed in the regular Medicare Advantage plans, where they have to be entitled to Part A and be enrolled in Part B. So they have to have Medicare. They have to qualify for Medicaid assistance of one level in most circumstances in order to fully achieve the benefit structure we are looking for in these programs. That's usually a QMB or a QMB plus. They have to reside in the service area that is designated for the dual SNP programs. And you'll see wider availability in certain geographies than in others. In the state of Texas, there's a dual SNP available, at least one, two, in actuality, in every one of the 256 counties in Texas. One of the things that is of interest and that differentiates this program also from a standard MA plan is the end-stage renal benefit isn't rolled into every one of these programs. It still may be handled by traditional Medicare, where the other Medicare Advantage programs that we offer outside of the SNP world, and specifically outside of the dual SNP world, well, that ESRD benefit is now part of the regular package. These folks have some great benefits by joining these programs. In addition to the extra benefits that are available to them, it does allow for a greater coordination of care. So what they got is worth more as well, because the plans are overseeing the benefits, tying together some of the different options that they have through the programs that they're part of and can really help that individual. These programs are generally for an individual who has these plans in place or the assistance programs, and so the applications that go in for a dual SNP plan are the vast majority of them anyway, are for an eligibility effective date of the first of the next month. So keep in mind, with February this year having 28 days, if you wrote someone on the SNP program on the 28th, they'd be effective the day after, on March 1st. You need to make certain folks understand how that works, because they won't have their card on time, but how they can access their benefits even though they are just coming onto the program. This gives us a little better explanation of how DSNPs handle the ESRD benefit. And it's important for us to note that I bring that up. It's not a cause of alarm in most bases. It's just that I want you to be aware of the fact that there are differentiations between different programs and the benefits that are covered within those programs as well. Another thing that's changed for folks that have been active in the low-income market in the past, where the special election period was available each and every month, that has changed starting the 1st of 2019. I know that's a couple of years ago, but I repeat it simply because some folks forget it's no longer monthly. You got one shot quarterly in the first 3 quarters. In the fourth quarter, it's handled as part of the annual election period. It's really nice, however, that the carriers that are active in this space have set up programs so we can check and see if a person, 1, is eligible at what level, and 2, have they already used that special election period. So having a good relationship with the management and a knowledge of the tools that are available with the carriers that you work with in this space is paramount for your success, because they can aid you in so many different ways. There are also additional steps that were made available to folks that are auto-enrolled or some other types of programs. And a lot of this designation, the split of these, came because of the challenge of the opioid epidemic of sorts that we are encountering. And folks that are at risk in this category, well, they'll look into the medications that they're taking. If there are opioids involved in many circumstances, that's why some individuals will change from month to month, because of limits on different medications or challenges with access there, and they're looking to address that situation by a delineation of the special election periods for folks in this category. It is also important to note, however, that the dual beneficiaries, well, they're 20% plus of the Medicare population, and so it's a very viable market for us as agents. It comes with an extrinsic and intrinsic reward. What are you talking about, John? Well, you're getting paid for it monetarily, but you also get a really good feeling with working with this population. So it's something that is available. We'll talk about details on who should actually be involved in just a moment, but it can be very, very rewarding for those who work with folks on a regular basis, and they do pay just like any other type of Medicare Advantage program that is commissionable, where the government sets the maximum compensation. It's different in different areas across the country and by different products than by have they been in a plan before or not. Is it first year or renewal commissions? What we're seeing, however, is a larger number of carriers investing in this area, making a much larger number of plans available across the country. They are not in every market. And in certain markets, you'll see what is referred to as a dual look-alike, where the benefits are tailored for this population, but the individual may not have Medicaid. That is a limited market opportunity, but particularly for you on the West Coast, that's something to look at. It also is an opportunity for us to engage with those folks that are offering these plans themselves. So the insurance carriers that are out there, an increasing number of carriers are being very active in the market. Many of them are investing heavily in this market, which tells us in the real world that, hey, it's worth something to them, it's going to be worth something to us, and they're going to be able to help us market these programs and understand what we're doing with them. You also see a unique situation here with this population versus the general Medicare Advantage population in the fact that these folks, if they're switching, it's generally someone guiding them to do it. So that is a good thing for us. It's also something we need to watch out for in order to instruct our population as to contacting us should someone else visit our people. Starting out, however, knowing what Medicaid and Medicare are, the differences. Medicaid's a state-run health insurance program, pays for a wide range of folks based on income and assets. So age is not a qualifying factor here, where with Medicare, many people think, oh, that's a program for the 65 plus, forgetting the folks that are accessing under age 65 because of disability. But this gives these folks that qualify for Medicaid the wherewithal to access care and have it be covered by a organization overseeing the program. And frankly, our government takes care of it. This is also the organization that federally funds Medicare savings programs, so we'll discuss the differences in them in just a moment. Well, here's the moment. These are, as it mentions, Medicaid administered programs. They do cover Medicare premiums and cost sharing for folks with limited income and assets that may qualify for that assistance, different levels of assistance. We'll go through them in a minute. And keep in mind, this is one of those lovely, what's the shade of lipstick on this pig? Because different states may refer to these programs differently. They don't necessarily have a universal or unilateral label in all of the areas in which we operate, in the 50 states. There are 3 different levels that we run into most frequently. I'll discuss an additional one in a little bit, but you have programs that are available based on the levels of income and assets. So these include the QMBs, the Qualified Medicare Beneficiaries, the SLIMBs, Specified Low-Income Beneficiaries, and the QI1 folks. They are all part of programs that are available to people who qualify for different circumstances. Being a Medicare savings plan, obviously, well, they got to have some form of Medicare. And in this circumstance, they got to have Medicare Part B. Some of these MSPs, however, will actually help pay for Part A premiums if a person has to do that. They have to meet certain income assets tests. I said that more than you probably care to hear already, but there are certain states that do not have the assets test being taken into play. So you've got 8 states plus the District of Columbia that's eliminated the resource test. So if you have someone coming into your state that's not one of these 8 or DC, you have to make certain that they qualify for these programs with the assets that the individual has. Most circumstances, it's not a big deal. In some cases, it can preclude them from additional assistance. The applications for these coverages are generally handled through the Medicaid agencies. You'll see a lot of folks that are accessing caseworkers at Social Security offices or doing the application process one of 2 ways themselves, accessing the forms off the internet for the specific program they feel they're eligible for, or if they already have assistance on the cost of their medication programs through the Extra Help Plan, LIS, that does migrate over into an examination to see if the person qualifies for a Medicare savings plan as well. However, that avenue takes much longer. We also need to remind ourselves and our clients that their eligibility is generally redetermined each and every year. And when we talk about the numbers of qualifications, generally we don't see those numbers for the different levels for the current year. Well, it used to be April. Now it's in March. There are different programs out there that you find on the internet that says they're 2021 numbers. Well, LIS numbers are out. MSP numbers are not. If you don't believe me, check what's being labeled as 2021 versus what you used in 2020. You'll see they're the same number. Hasn't changed yet. Will shortly. We have to deal with the numbers with what we've got and the current qualifications until we receive that updated information. Some of the reasons why these MSP programs go beyond just, wow, it's going to give me extra help on my cost of some of my services or at least my Part B premium. Well, it also deals with any Part B penalty that has come into play. So this takes care of that in addition to the standard Part B premium. This is not a program that is subject to a state recovery. So it's different than programs that are set up for folks that are in nursing homes or care facilities of that sort. And people who are on an MSP automatically qualify for Part D extra help. So these folks also have those modified out-of-pocket expenditures from what may be listed on the plan itself. It's something we really need to be made aware of. And in many cases, it's that LIS covering the premium piece of the PDP programs that may apply for certain MA plans who split out costs between medical and prescription. You do have a ton of help out there that helps explain these programs. If you guys haven't been on YouTube, gee, that sounded terrible, on a particular YouTube channel that addresses this, you may be missing out on some of these neat programs that are available for your use. You have to make certain they come from the right source. But the National Council on Aging has a really nice recording on Medicare savings plans, and they even speak of the excluded assets that an individual has when they look to qualify for these types of programs, Medicare savings plans. keep in mind, that's not a DSNP. That's a different governmental program that excludes one house and one car, regardless of the level of assistance or the value of those assets as well. When we look at QMB, the Qualified Medicare Beneficiary, these are folks that are at 100% of federal poverty level or below, or less than 100%, I should say. And the income levels vary according to where the person lives in our country. They have the standard assets test in 48 states, and we see that as a variable between the individual that's married or single. It is, however, also a program that has a max income. Now, this is gross income, not net. So if someone gives you a Social Security statement and say, hey, this is my check, keep in mind there's Part B premium involved in there in certain circumstances, or disregard that we need to look at. And those income and assets tests are higher in Hawaii and Alaska. So with the standard 48 states, the lower 48, it's a lower income with the assets test that has to be involved as well. Whoops, I missed this part, actually. What do they get with QMB? Well, this is the program that will cover Part A premiums if applicable. Doesn't happen in vast majority of folks that we talk to with the plan, but it does address the Part B premium. And as we mentioned before, any penalties that might be involved. These programs do help with the deductibles, co-insurance, co-payments with their standard Medicare program. They're on traditional Medicare and they have Medicare and Medicaid. They may not be coming out of pocket for regular medical services at all. So it's something we need to be very aware of. When we look at the SLIMBs, these are for folks that are at 100% to 120% of federal poverty level with the same assets test we see applied for the QMB programs. This covers the Part B premium only, any penalty that might be involved in it also. So they don't get any assistance with Medicare's medical uncovered costs. And these folks, because it is a level of Medicaid that isn't as comprehensive as QMB or True Medicaid, they're not getting a lot of help with any ancillary services either. So a great source of prospects that are willing to look at programs, and we just make certain that we're showing the correct one, because in many circumstances, for an individual who qualifies for these programs, they have to have also a means for addressing beyond Part B premiums. So it can make a big difference for them. It is also the same standard that lays out for the qualifying individual. This level of assistance also only pays for the Part B premium or any penalties. And much like SLIMB, this is a target market for folks that aren't as accustomed to all the extras and are a good source of referrals. They're also a great way for you to positively influence their day-to-day life, because getting a person on one of these programs, well, you're covering that Part B premium for them through the government, or you're helping them get the coverage, I should say. You're not covering them. It does give them flexibility for purchase of other programs, and also make certain that you can positively influence their life day to day. It's one of the intrinsic rewards I referred to earlier. The fourth category that I didn't list up front is one that I'm going to tell you, having worked this area for over 25 years, I have run across a qualified disabled working individual once. Not to say that they're not out there, but I have not encountered them. These folks would be a special class of people to run across to even define much higher income limit for this assistance, but they are also the folks that are attempting to go back into the workforce and are no longer eligible for free Part A. So some different things that are available, wanted you aware of it if you ran across these folks. One of the things that you see are different pieces that are available through different organizations for us to use, which we can, to help explain the differences between these levels should it get into that sort of discussion. In many cases, the only time that would happen is if you ran into an individual that qualified for these plans and wasn't on it yet. And I got to tell you, in each of the categories, there are people that qualify, a good percentage in many cases, that qualify for these assistance plans and aren't on it for one reason or another. This piece is one I use a lot in presentations and in discussions with individuals. It's offered by the National Council on Aging. It really lays out the information pretty simply as to what the qualification factors are, when different programs are effective within that qualification category, and what the person gets for this. So one of the things I wanted to show you is where it's generated, and keep in mind this is one of the links that will come to you as part of the follow-up to today's program. It's a small attachment, so I might try it that way as well, but it is a great piece for you to use in your presentations, and will be headed for you. This is one of the sources I use to see when the new qualifications come out as well, because this one is still designated as 2020. It's a source of truth then for comparison with folks that say, I've got the 2021 numbers for LIS. They do. We have those. Those will be attached, but not for MSP. And it breaks out the two different states, obviously, with the different levels. Why doesn't everybody who qualify for this have it in play? Well, sometimes they don't know the programs are out there. Sometimes it's difficult to complete the paperwork to get in. In Texas, at one time, this was an 18-page application, very fine print. And sometimes then folks will look at that. You got a hard copy of this. I need someone to help me. Accessing a caseworker isn't that easy, even when we're not in this semi-lockdown pandemic. And folks sometimes have a hard time getting there. And there is a portion of this proud population that has that misplaced social stigma where recipients of these programs are on welfare, on the government dole. We need to make certain that they realize that it is an entitlement program that is there for their use and is brought about by just the need for people to get help in certain circumstances. There are certain things that you can do to help people get into these MSPs, and that includes knowing about them and being able to then help that individual by sending them to a social worker or using My Advocate or benefits checkup with one of the Medicaid or Medicare carriers that you contract with, or you can actually help them fill out the app themselves if you wanted to. Not a fan of hard copy applications. Doing this online through one of these other services really speeds up the process, and in many cases makes certain that all the categories are answered. We also need to be aware that there are certain demonstration plans in certain states that may affect how we operate in the DSNP space. So in some of these different states, this dual demonstration plan, which is a program that in Texas is called STAR Plus, these are plans where the government agencies offering Medicare and Medicaid are offering a singular program in these different demonstration areas. So how's that matter? What's that matter to us? Well, it's taken a portion of our population out of our prospect base. It's also a program that in certain counties, if those carriers that are part of the managed Medicaid benefit or administrators in those select counties, it can affect our commissions. So something to be aware of and to look at. STAR Plus has been around in Texas since before the turn of the century. Boy, that makes me feel old. Started out in the Harris County, Houston area, has grown to every county in our state. Specifics for you, if you're in one of those demonstration states, we need to get you information specifically about your state. And in many cases on MSP programs as well, because different states can operate differently. This demonstrates the managed care product for Medicaid in Texas. What we need to be able to do is be on top of the requirements, the different pieces of information out there by reading and studying. It does help to practice these type of programs to make certain you're covering everything. I said on one organization's DSNP trainings not long ago, and they said, you don't have to talk about all the benefits. As a former director of SNP plans for one of these major carriers, I just shuddered. That is grounds for a complaint moving forward. You got to make certain that folks understand everything that is inclusive of these programs, and many times that comes with practice. These are a population. This is a population that we can legally target. We're not redlining or doing adverse selection. We're looking for folks that can cover or are covered by these programs or can be covered by these programs, and we'll talk about how we do that in just a moment. Obviously, you also want to make certain that you contract with the carriers that are pertinent to your area. There are a ton of carriers out there, may operate in a particular space and may not be as competitive as some of the other dual plans. So we need to make certain that we have in our portfolio those programs that make a difference for these folks, and then leverage that information, translating the gobbledygook that many people read. The government does give us different Medicare trainings on this as well. The Medicare Learning Network has some really cool presentations that we can use with the public, but also use to make certain that we understand the programs as well. And they have the different options available on YouTube for you to use too. That national training program that I keep referring to, well, it gives you great material to use to become not only cognizant of these different benefits, but comfortable in discussing them. And a great way to access other resources as well through this government-supplied organization. Different carriers do it too. Most of the major carriers in this market will have dual presentations available for you. It does work as an efficient sales track for you to follow to make certain that you don't miss out on the key points you have to cover in each Medicare Advantage discussion. So utilizing one of the presentations by the carriers, featuring Humana here, United has one, Centene's companies have one, including WellCare, Anthem, Blue Cross Blue Shield in certain markets. So they're there for your use as well. And we use then the Plan Finder to find out where we can locate these different program eligibilities. We can go into Medicare.gov, search for the health plans, look for updated information, pull us in there as an individual without logging in, answer a few questions appropriately, and you'll see a big difference between the number of plans that are offered in most markets that are regular MA plans versus MA plans with a SNP designation. In Denton County, which is just north of Dallas, we go into a zip code that I live in, 75067. You'll see that there are 46 regular Medicare Advantage plans available. When you add in the special needs plans, you go from 46 to 63. So there's a lot of programs out there in certain markets, and we can identify them through this system. And you'll see when you pull up the plan choices, they're designated in that software package as a DSNP. So that helps us know what is available. That doesn't necessarily tell you if it's available for broker distribution or if you get compensated on it. There are other private organizations that can get you information as to the availability of these plans, and then utilizing some other resources, we can help you determine how big a market this could be for you. So this is a great site. The QI1 Medicare site has a lot of information on plans and other pieces of valuable information as part of it. Working this area, it's really important for you to totally understand the mechanisms that make up the delivery of these benefits. So we got to know the plan and the network. Network is key. We need to know about the different assistance programs that are available, maybe how they're labeled in our state, and is there managed care for Medicaid in our target market, and then is there a managed care program that is labeled something in our state that it could be a dual demonstration product as well. I list this here because it reminds me to speak to the different managed care programs. This is the designation in Texas. If you're working this area, be prepared for a longer appointment than a standard Medicare Advantage appointment. A lot of the folks that are on these programs are of lower education levels. Sometimes there's communication challenges. Sometimes you have to have a third party involved that may be an influencer in that decision. A lot of times it's the children of the beneficiary. So working with the family can come into great play by knowing that they can be a huge advocate for you, or they can knock you out of the box. We talked about a special election period being available once a quarter. Well, keep in mind, having multiple steps like that can work against you as well. So it's important for us to set up follow-up with these individuals so they aren't under the direction of someone else to switch them off our programs to another one that may not be as valuable to the individual, certainly not as valuable to you and your practice. There are a proliferation of trainings that the carriers put out there on these programs. And I understand that you may have a grasp of DSNP overall, but if you're going to work with a particular carrier, attend one of their trainings. They do some magnificent things there that help identify the source of some of those ancillary benefits, how their program works specifically. They'll address, in most circumstances, the network, which can be key with this. And, of course, then the government does kick out material for us as well. So if you're in one of those areas that have multiple special needs programs, we want to compare those extra benefits, make certain that we look at all providers of care for that program, and how good's the carrier standing up to help you with this program as well. Some really strong reference material from the government, great pieces that are out there. I'm sliding through this fast, but you'll get this presentation with those links and find out where you can go for government help in actually explaining and marketing these programs. This is a population, depending upon the level of assistance, that while they may be limited in means, income, they are valuable prospects for other programs as well that are of need. So maybe an additional dental coverage that is necessitated by a known need in the near future. They may be great prospects for you for a little life insurance or final expense, those sorts of things. So keep in mind, having more policies in the house drives up your retention, and discussing them really differentiates you from your competition as well. And then we have tools that can help you cross-sell in that area, be it in person or virtually. Where are these prospects? Well, generally, when I was the regional for the SNP programs for United Healthcare, we spoke of go to where they eat, worship, live, or access care. And you'll see that influenced by centers of influence in the community as well. We're looking at different locations such as food banks, low-income housing, working with faith-based organizations, providers of these programs, the folks that actually deliver the care for the plans that we sell, and then, of course, some of the ancillary carriers, particularly home health, and I should have on here DME, because they are influences in that decision as well. As often as you may be in conversation with some of these folks, I would wager to bet that folks that are involved with your prospects and clients are also somebody else's prospects and clients, and may be influenced by the home health carriers or home health aides that come in much more frequently than you visit them, or suppliers of their oxygen or whatever else need they have for DME. When we look at the food banks that are involved with this, we see an increased demand on this because of some of the challenges that we've had with COVID, more people needing help with what they have to eat. But this is a great area to work with, and many of the carriers actually have marketing campaigns that can help you work in conjunction with food banks, because it is obviously a source of nourishment for the low-income individuals and families. These folks are generally operating on a collection privately and then distributing those pieces of donated food to the community. This isn't like some different programs that may prorate what something costs by eligibility. The food through these programs are all supplied to the folks that are accessing it at no cost. You also can find out where these facilities are by foodpantries.com. It's an illustration of one in Oklahoma City. A great way to figure out, well, gee, where do I go to approach these folks? Here's where you go. Here's your source of truth. It does give you a great way of influencing the community as well, because if you're able to help some of these folks alleviate some of their financial concerns, some of the resources they may be accessing on a regular basis now, they may not have to in the future, so you're freeing up some things for other folks as well. There are standard things you do in an approach of any center of influence, and that includes working with that gatekeeper. This area is more heavily influenced by in-person visits. That, of course, has been changed a little bit over the last year. So these folks are used to dealing with callers as well, but they're distributing food on a regular basis. They're seeing folks on a regular basis, an essential type of opportunity for them, or, well, it's not shut down, is what I'm trying to say with some of the others. The carriers have great tools for you to work with this population, and it is one that is really influenced by just common courtesy and the whole thank you. They don't always get that all that much. We also want to look at low-income housing units. These are areas where they live. And in many circumstances, this is an opportunity for us to present to groups, be it live or virtual as well. So there are ways to find these folks as well. Some of the folks that are qualifying for low-income housing aren't even in it. So we need to look at different residential requirements for different facilities. You can find it online here at lowincomehousing.usa and help lay out just where some of these locations are. Here's a listing once again in Oklahoma City where there are senior cottages, and it is some subsidized prices to a degree on the cost of living in that facility. You also have a population that is available through different types of domiciles too. One of the things we see a lot is for folks that are in trailer parks, lower income individuals in many cases. The office manager in these locations does frequently work with the population to educate them and make available different services. So you can do different things to address this population. We have a whole section we go through, and I'm going long on this already. I apologize. On faith-based organizations, but this is a population that does in many circumstances hold their faith close to their heart, and these individuals will respond to information disseminated by their faith family much more frequently than in many other influences, even more than their doctors. So it's something that we can address, not just for this population, but for general outreach on all the programs that we offer. And we can locate these locations through churchangel.com as one source, where you can punch in a zip code and it'll tell you, in this circumstance, where all the facilities of Christian faith are available to you. We have similar sites for the Jewish population, for the Islamic population, different sites that are available that help you identify where this center of influence is located. It is a program we go into in great depth, so I'm going to include the link to this particular type of community outreach, and so we'll fly through this pretty quickly. Just did, one page there. There are the provider partners. Obviously, this is a great source of referrals too, and working in this area, well, with general MA plans, sometimes the specialists can really be of great influence for you, not as much in this category, but if you're working with particular carriers, a great source to find out where these guys are, it's your provider directory. And then working with this population is also addressed in a special training, so we'll get that link to you as well. Never put all your eggs in one basket. You make certain that you deliver services of value. You ask for referrals, and you're consistent in your approach with all of the categories that are available for you in finding where these individuals are. So one of the things we also want to make certain that you realize, there are certain things we do here at Premier that can help you as well. If you're looking to contract with multiple organizations, this is a really valuable tool. Creating an agent profile Insurance Bay gives you the opportunity to contract electronically with multiple carriers. You're creating your profile, you're loading in your E&O, you're answering all the standard questions for contracting through a generic base. It applies it to the different companies that you're looking at to contract with electronically. We also offer discounted errors and admissions for our qualified agents. What makes you a qualified agent? Well, you got to contract with us. There's the qualification. But it's a program you own and protects you regardless of the insurance product type and who you're contracting through. So you own this policy. You pay for it, discounted rates, but it'll protect you regardless of whom you're contracting with. And as an independent agent, that's important, as is making certain that we keep our licenses up to play, and that includes offerings of discounted E&O through our organization, through our relationship with WebCE. We also have programs out there that can help you with your own benefit package. You can qualify for modified guarantee issue programs on yourself at discounted rates where you are paid a commission on it as well. Much as where today's presentation is being recorded, we've recorded other presentations in the past. They're available on our website in the library of past recordings and also on our YouTube channel. They deal with different topics and will be highlighted in some of the follow-up that you see because you'll get linked to certain ones that I promised already. Dealing with the faith-based organizations, marketing through providers, some of that will come as links as the follow-up. And the tools that we offer electronically through our organization, particularly through Medicare Center, are a great help for you. It comes with a CRM so you can figure out how you can handle your business efficiently. It's got a single login, 3 different quoting tools within it that are powered by Connecture, Sunfire, and CSG. So they're there for your use at no cost through our organization as a contracted agent. It's also important to note that these programs also help you with the pre-appointment compliance work where you can send out the electronic scope of appointment, store it in this for that required 10-year period. Whether you sell them or not, you have to store it, and it's a great tool to use in that regard. Helps once again with that cross-selling, and we do have a section that helps you identify the different incentive programs by the different insurance carriers. Keep in mind, in the Medicare space, with Medicare Advantage and prescription drug programs, there aren't bonus programs. There are kind of some frequent flyer programs, in a manner of speaking, that can help you with training, certification costs, but they aren't part of an incentive program like other ones are that can help you qualify for Premier's incentive program as well. So outside of where you can find some of these individuals on your own, we have different things, obviously, again, that can help you locate them. Keep in mind a contact list for these individuals. Well, you can't cold call them for a DSNP program, so we need to make certain that any outbound telephonic activity is compliant and works on as part of your overall marketing program. I already discussed those community programs that we help you with, become involved with, and work efficiently. This is a space, the Medicare Advantage dual special needs space is an area where those carriers that are offering those programs may very well have leads for you year-round. So it behooves you to know who your local management is, speak with your upline, and to make certain that if you don't have a relationship with those folks, that you get set up with them and utilize that resource. Cannot overemphasize how helpful that is in the dual special needs space. We also offer internet leads and direct mail support. So direct mail support is a discount program based on production and through certain vetted partners. It's a great way for you to consistently get in front of folks. And I got to tell you, they're all running specials on DSNP programs right now as well. And these are some of the most effective direct mail programs that are available for you in the community. We do also help with direct mail response programs where you're not handling the entire mail campaign, you're just buying responses. Keep in mind that can help very well with folks with a limited marketing budget, but these folks may not be as fresh as a program that you direct on your own. It's the responses you get on your own direct mail program come to you through the vendors' CRMs the day they're received. These obviously are a tad older than that, though they are non-contacted leads. And we have two different sources that you can use to do it. The online Facebook programs that we have are for final expense, and Medicare leads, it generally pursues Medicare Supplements. So maybe not as frequent a list of prospects for you or a means of prospecting for DSNPs. All that said and done, through all that complicated, sometimes seeming numbers that are available, you have a possibility of a working relationship with us specifically in this area where we can help you in your market become educated as to the type of programs that are available and what resources are available to properly market. Looking at some of the questions, I've missed a couple people because I've gone long, but they are asking if this applies to someone with COPD. COPD would be a CSNP program if available in your market. It is based on, those programs are based on having COPD. Income and assets don't have a bearing upon eligibility. Some of the folks with COPD may also be a dual beneficiary, and this program has the richest benefit. So if you got someone who's got a certain health condition, you're wondering if you should use a CSNP versus DSNP, go DSNP. Bigger benefits, and it'll take care of them. What states will pay Part A premium for those who do not have a work history? Those without a work history and paying for Part A subsidies, I honestly don't know of one state that does. There may be private organizations that help them get coverage, but if they don't qualify for Part A coverage, even at a level that they could purchase that assistance, it's just not available for them. How do you recommend to reach those in a senior or subsidy home, such as getting names or apartment numbers to send to occupants? That is a situation where you need to create a relationship with management in those particular facilities. Or in the old days, we used to use the old crisscross. If you know the address of this organization and you wish to target it, direct mail campaigns can be obtained through some of the lead list companies or the mailing vendors by identifying those specific addresses. So you can target them even at a greater rate than a regular mail campaign. All that said and done, we're made 8 minutes over. We're asking for your business in this area. We want to be a resource for you to help you here as well. But it's also a circumstance where you need to make certain that you either put this as part of your marketing program, either on being aware of it for folks that you run across, or you look to target it. There's a ton of marketing material out there with the different carriers. A great way for you to incorporate this into your overall marketing program, but you may want to look at this as, hey, I'm going to do this during this time period, specifically here. Because a lot of it, as we get back to the real world, may be face-to-face in the future. And it's not the right thing for everybody to chase, in all honesty. If you are an agent that is commonly working with Medicare Supplements and you work cross-selling long-term care programs, life insurance, regular life insurance, higher ticket items, it may not be a viable resource for you to pursue for your normal agency activity. For some folks, all they do is DSNP. So where you are from one extreme to another, well, we want to help you become active in the area if it fits your practice, but also to do it on a consistent and educated basis. So all that said and done, I'm going to check for any additional questions. We appear to be good. Watch for the follow-up information that we'll send you on today's presentation. I think some of the attachments you'll find are very, very helpful for you. You can respond to that email communication, or you can reach us through 1-800-365-8208. Speak with the marketer that you're dealing with Premier Marketing. If you don't have one, we'll get you one. Or you can access contact through our website at Premier SMI as well. We will be following up to make certain that you have your questions answered on today's presentation, or if you're interested in further involvement. And until we have conversations such as that, or have the opportunity to chat with you in the very near future, well, we're wishing you good selling. Thanks so very much, and hey, we'll talk with you soon.